Hi, this is Dr. Jonathan Hall coming to you from Boston. Today we're going to talk about how to optimize your nutrition to heal better after plastic surgery. Plastic surgeons are trained in complex wound healing problems, and I have many patients ask me what they can do to optimize their nutrition and heal better after their plastic surgery. So today I'm going to review with you what's known in the literature. So again, this is going to be a science-based review, and to help you minimize your risks and optimize your results with your plastic surgery. I'm going to talk about what's known about the science of nutrition as it comes to healing, and I'd like to emphasize that this is not magic. Taking extra of something that you already have enough of is probably not going to help you heal better if you're already well nourished. In this video, I'm going to review with you the science and what I think makes sense for most people based on my experience. So again, the most important is to not be deficient in something critical for healing. And I'm going to base a lot of my discussion today on a review article which was in a recent plastic surgery journal. So number one on the list of important things is protein. Making certain that you have enough protein to heal is critical. About 25 years ago, we started seeing patients that had had bariatric surgery. I had a lovely lady who came to me for a thigh lift. She'd lost 120 pounds with a gastric bypass, and surgery went great. She looked great, but 3 weeks after surgery, her incisions started to fall apart. I had her at the hospital getting antibiotics, and I went off to our plastic surgery meeting, and one of the plastic surgeons from Dallas stood up and he says, "Hey, you know those patients that have had bariatric surgery and then they come to you for plastic surgery and their incisions just kind of fall apart after 3 weeks?" And I'm looking around the room thinking, hey, was somebody in my hospital? But he said, made a lot of sense that bariatric patients are not absorbing enough nutrients. That's why they lose weight, and including protein. And all wounds get weaker for 3 weeks and slowly start to heal from the 3rd through the 6th week. So it makes sense that if you don't have enough protein, that your incisions might start to fall apart. So since that time, I've had my patients take 80 additional grams of protein a day starting a month before and a month after surgery to help with the healing. These patients that have had bariatric surgery. So in fact, there was an article then that came out later on a study in 2016 that looked at abdominoplasty patients following massive weight loss, and they showed that protein supplementation with high quality whey protein actually decreased the risk of complications from 22% to 0%. So that's pretty significant. So again, I recommend extra protein for all of my patients who have had bariatric surgery. I know that some doctors are also starting to recommend supplements of protein for patients who have had significant weight loss from these semaglutides. And I also recommend protein as well for any of my patients with a low BMI who are going to have surgery. My late wife had a 14-year journey with stomach cancer and had many episodes of surgery and many needs for protein, and she had a chance to try a lot of the different supplements, and she found that her favorite was Premier Protein, which is a brand that they carry at Costco and some other stores. Since that time, Fairlife has come out, and some patients prefer this. Both are available at Costco and most stores. And so again, on the slide here, I recommend protein for any significant weight loss patients after bariatric surgery who are going to be having a subsequent plastic surgery, patients who had weight loss after these semaglutides, and low BMI patients, generally a BMI of less than 18, because those patients also are generally not absorbing enough protein to heal their incisions. So it's interesting that the recommended daily amount of protein is 1 gram per kilogram of body weight. So a kilogram is 2.2 pounds. So this would mean that a 220-pound man should, as a baseline, have 100 grams of protein just to be healthy. And you need additional protein to heal. Some wounds require another 90 milligrams of protein a day. So I recommend starting with 80 grams of protein a day, starting a month before and after surgery. And we really haven't had those healing problems since doing that. So next on the list is vitamin C. Now, there are no high-quality research studies that show that just taking extra amounts of vitamin C help to heal wounds. The only study showing this was in a supplement that contained other components as well. So extra vitamin C doesn't hurt because as a water-soluble vitamin, it's hard to really take too much. And if you're deficient, it can help with healing. So I've generally recommended that my preoperative patients take 500 milligrams a day starting 3 to 4 weeks before surgery of the vitamin C. So next on the list is vitamin D. And as many as 36% of otherwise healthy 18 to 29-year-olds are deficient in vitamin D. The overall prevalence of vitamin D deficiency in U.S. adults is 41.6%, with the highest rates in blacks at 82.1%, and followed by Hispanics at 69.2%. So if you're not able to absorb enough sunlight, or you live in northern climates, or both, you may not be getting enough vitamin D naturally. So again, most studies on vitamin D supplementation in surgical patients have been done in the orthopedic literature, healing bones. One study in diabetic ulcers showed better healing and better glucose regulation by supplementing with vitamin D. The Institute of Medicine reports in otherwise healthy people 400 international units per day, and the Endocrine Society recommends 200 international units per day to optimize your calcifidiol levels. Large orthopedic studies in trauma patients recommend 1,000 to 2,000 units per day as being more effective in healing. So you might want to be careful if you have a history of kidney stones, but 1,000, 2,000 international units of vitamin D a day can help with healing and is generally a good thing to recommend. So next on the list that they have, and again, this is a table from this research article, are arginine and glutamine. So I've not routinely had my patients supplement with arginine and glutamine before surgery, but these can be very important if a patient is having trouble healing after surgery. So I also take care of my practice, some elderly patients with skin cancer in addition to my aesthetic surgery practice. And if any of them start to have problems healing, I've recommended the supplement called Juven, which is made by Abbott Labs, and that's the same company that makes Ensure. It has arginine, glutamine, and a proprietary amino acid that they call HMB, which is a long word of beta-hydroxy beta-methylbutyrate, and that comes from leucine. They also have zinc, vitamin B12, and collagen in this. Again, unfortunately, my late wife, with the 14-year journey with cancer, would get skin breakdowns in the hospital, and I would ask permission from the nutrition department to bring in the Juven. They didn't want to pay for it at the hospital because it was $50 to $60 a week, but we found that this worked great and helped her to heal her bed sores after 2 or 3 weeks. It's been shown to reverse some muscle wasting in the elderly, and it comes in orange, fruit punch, and an unflavored, and generally you drink 2 a day. So next on the list is omega-3 fatty acids. So there are several studies suggesting that omega-3 fatty acids improve wound healing, glucose control, inflammation, and infectious and non-infectious complications, as well as length of hospital stay and mortality. So again, these are generally in sicker patients. The interesting part is that we were taught that fish oil can increase bruising and bleeding. They had a review of 52 studies that did not show an increase in bleeding or blood transfusions after surgery. There is a perioperative nutritional supplement by Nestle called Impact that includes fish oil-based omega-3 fatty acids, but there are no clear recommendations on suggested amounts. My impression over the years is still that despite no increase in transfusions or surgical bleeding in the studies, that they may still increase your risk of bruising if taken before surgery. So maybe add a gram or 2 a day after surgery to help with recovery if you're so inclined. So vitamin A is another one where you don't want to be deficient, and it can be important in reversing steroid-induced inhibition of wound healing. But there are, again, no major studies suggesting that by itself extra vitamin A can help with wound healing. And because it is fat soluble, it is possible to take too much. It's interesting that extra amounts have even been shown to increase the risk of lung cancer in smokers and maybe even in former smokers. So I've not recommended extra amounts of vitamin A routinely in my patients who are otherwise well nourished. Zinc supplementation was shown to help in patients with diabetic foot ulcers. But again, these are patients that are not completely healthy to start with. So I've not recommended zinc supplementation routinely for my surgical patients who are otherwise well nourished. And it was interesting that toward the end of the article, they threw in some information on curcumin from an article that they found from some Italian doctors. And the plastic surgeons cited this article from Italy, which looked at possible beneficial effects of curcumin on wound healing. And they go through the possible beneficial effects. But then the Italian doctors conclude that although it could be considered as a wound healing agent, further research is recommended. So there really isn't a strong recommendation. Again, I think this falls in the category of can't hurt, might help. If you want to start after your surgery, talk with your physician about it. I've seen no other strong recommendations for curcumin, but it's interesting. And finally, at the end, the authors throw in arnica and bromelain. These are some homeopathic measures that we've talked about for years. They have some actual articles supporting arnica as helping with bruising when used after surgery. They also note that bromelain may help with swelling, and note that bromelain can upset the stomach when taken by itself. So they've thought that patients might instead eat fresh pineapple as a source of bromelain. My feeling is that these again fall into the category of can't hurt, might help, but wait until after surgery if you want to add these. We do routinely recommend these in procedures such as liposuction or facial surgery to start after surgery to decrease bruising. So I didn't want to leave the impression that adding vitamins and mineral supplements is a good idea for everyone, especially in large amounts. This plastic surgery article specifically references studies of patients who are in the hospital or having surgery or other wound healing issues. I know, for example, that the National Institute of Health, the NIH, has shown that taking extra vitamin E, which was a fad for many years, can actually be harmful to your health. And I did mention again that extra vitamin A in some of their studies can actually increase the risk of lung cancer in smokers and former smokers. So the NIH has a web page on the use of multivitamins and mineral supplements, which you can look up. And I've shown this here in this slide. So as always, talk with your doctor. The NIH recommends that nutritional needs should be met primarily through foods. They're not opposed to taking a multivitamin that doesn't exceed the normal daily requirements, but recommend selecting one for your age, sex, and stage in life, such as pregnancy. I see no harm for most patients in adding a multivitamin such as the appropriate Centrum to make sure that you're getting the recommended daily amount and are not deficient. And again, the Centrum brand has Centrum Silver for older patients, they have Centrum for pregnant patients, for women, for men, so something specific for your age and stage in life. So once again, the most important, still in my experience, for patients to make sure they're not deficient in is protein. If you're deficient in protein, you can have trouble healing. Again, the recommended daily amount of protein is 1 gram per kilogram of healthy body weight, and this is without having surgery, just to maintain your health. So discuss this with your surgeon, but for my patients who have had bariatric surgery, have been on the semaglutides, or have a BMI less than 18, I strongly consider and recommend that they take 80 grams of protein a day, starting for 4 weeks before and 4 weeks after their surgical procedure. And again, two consistent patient favorites are Premier Protein and Fairlife Protein. It doesn't hurt to add some vitamin C and D, especially given the high prevalence of vitamin D deficiency in U.S. adults, and especially here in New England, where our days are shorter in the wintertime. Again, Juven is a great source of arginine and glutamine, and it's available at CVS, Walgreens, Walmart, Amazon, and you get 1 packet mixed with water twice a day. This has been extremely helpful for my elderly skin cancer patients if they're having any trouble healing, and also for my aesthetic surgery patients if they're starting to have trouble healing despite our other measures. I've talked with Abbott, and there is no benefit to taking more than the recommended 2 packets a day. So it comes in fruit punch and orange and unflavored. My late wife, after her chemo, found her taste had changed, and she liked the unflavored mixed with juice. I've tried the fruit punch and the orange, and I'm probably showing my age here, but the orange reminds me of the tang that we had as kids when we were dreaming of becoming astronauts. So on fish oil, omega-3s, there's no clear recommendation for omega-3s. The studies don't suggest more bleeding issues with fish oil taken before surgery, as we had been taught. But to be safe, I'd say maybe add a gram or 2 of fish oil starting a day after surgery to help with recovery if you're so inclined. and your doctor is in agreement. So this has been Dr. Jonathan D. Hall coming to you from Boston. Today we discussed the scientific evidence and what it shows us about nutrition in the perioperative period to optimize results and minimize risks with your plastic surgery. We learned that the most important concept is to not be deficient in the components that are critical to healing, especially protein in patients who have had bariatric surgery, been on the semaglutides, or have a low BMI. The best way to get nutrients and minerals is still a healthy diet, but we learned what the studies have shown about adding other supplements before or after surgery to help with healing. So thanks for listening, and I hope this helps you in your plastic surgery journey.